Assalamualaikum warahmatullahi wabarakatuh. This is a presentation about chronic kidney disease. And this is our group member. So what is chronic kidney disease? Chronic kidney disease is a long-term condition where the kidneys lose their ability to filter waste and excess fluids from the blood properly. This damage occurs gradually over months or years. Moving to the next part, what happens if chronic kidney disease left untreated? First, waste build up in the body. Second, high blood pressure. Third, heart disease. And fourth, kidney failure. And what is the symptom? First, fatigue or weakness. Second, swelling. Third, frequent urination. Fourth, foamy or bloody urine. And last, loss of appetite or nausea.
Now we move on to the causes of chronic kidney disease. There are lots of diseases that can lead to this problem. One of them is diabetic nephropathy. So what causes diabetic nephropathy to happen? Firstly is hyperglycemia, or what people call high blood sugar. Elevated blood glucose level lead to the formation of advanced glycation end product, which promote inflammation and fibrosis in kidney tissues. This process damages the glomeruli, the kidney's filtering units, leading to albuminuria, which is protein in urine, and eventual kidney dysfunction. Second is hypertension or high blood pressure. Chronic high blood pressure increases the workload on the kidney's blood vessel, causing them to become thickened and scarred. This impairs the kidney's ability to filter waste efficiently and accelerates the progression of kidney disease. Third is genetic factors. Genetic predisposition play a significant role in the development of diabetic nephropathy. Variations in genes such as APOL1, ACE, and COL4A3 have been associated with an increased risk of kidney damage in individuals with diabetes. Additionally, family history of diabetes and kidney disease further elevates risk. Fourth is inflammation and oxidative stress. Hyperglycemia induces the production of reactive oxygen species, leading to oxidative stress. This activates inflammatory pathway, including nuclear factor kappa B pathway, resulting in kidney cell injury and fibrosis. The fifth is dyslipidemia or abnormal cholesterol levels. Elevated levels of LDL cholesterol and triglyceride contribute to the development of arteriosclerosis, which can impair kidney blood flow and function. Managing lipid levels is crucial in preventing kidney damage in diabetic individuals. And lastly is smoking. Cigarette smoking accelerates the progression of diabetic nephropathy by increasing oxidative stress, promoting inflammation, and reducing blood flow to the kidneys. Quitting smoking is essential for individuals with diabetes to protect kidney health. Next, we move on to the treatments. There are lots of treatments for diabetic nephropathy. One of them is hemodialysis. First of all, what is diabetic nephropathy? It is a common and serious complication of diabetes mellitus. It is a leading cause of end-stage renal disease worldwide. The condition affects countless individuals, especially in countries like United States, where a large number of people with diabetes eventually require renal replacement therapy. As kidney functions continue to decline in these patients, managing their health becomes more challenging. Among the available treatment options for advanced diabetic nephropathy, dialysis becomes essential in helping patients live longer and maintain a better quality of life when kidney failure sets in. Now that we know what is diabetic nephropathy, we need to know what is dialysis. Dialysis is a treatment for people whose kidneys are failing. As kidney function declines, patients often require renal replacement therapy, most commonly in the form of dialysis. It removes waste product, excess fluids, and toxin from the blood, helps maintain proper chemical balance, and controls blood pressure.
Treatment option: hemodialysis. When kidney function deteriorates to a critical level, patients require renal replacement therapy. One of the most widely used is hemodialysis. Hemodialysis involves filtering the patient's blood through a dialyzer artificial kidney to remove waste product, excess fluid, and correct electrolyte imbalance. Hemodialysis is the most common type of dialysis. It utilizes a dialysis machine that removes blood from body, usually from vein in arm, filter it through an artificial kidney, dialyzer, returns clean blood to body. Hemodialysis may cause low blood sugar due to changes in insulin clearance and reduced food intake during treatment. This is concerning because many diabetic patients on dialysis have autonomic neuropathy, which makes them less likely to feel the warning signs of low blood sugar. To perform hemodialysis, a reliable vascular access is needed, usually through a fistula or a catheter. However, diabetic patients often have poor blood circulation and damaged blood vessels due to long-term high blood sugar. Procedure of hemodialysis. First, preparation of hemodialysis. Before initiating hemodialysis, a vascular access point is surgically created to facilitate the removal and return of blood during treatment. Common types of vascular access include: first, arteriovenous fistula, a direct connection between an artery and a vein, typically in the arm. This is the preferred access due to its longevity and lower risk of complication. Next, arteriovenous graft, a synthetic tube connecting an artery and a vein, used when blood vessels are not suitable for a fistula. And last one is central venous catheter, a temporary access inserted into a large vein, often used in emergency situation. Second step, initiation of treatment. During hemodialysis session, first, we have the access site preparation. The access site is cleaned and sterilized to prevent infection. Second, needle insertion. 2 needles are inserted into the access site, one to draw blood out and another to return the filtered blood. Next, connection to dialyzer. The needles are connected to a dialysis machine via tubing. Procedure of hemodialysis. For the third step, blood filtration process. The dialysis machine performs the following. First, blood circulation. Blood is drawn out and passed through a dialyzer and artificial kidney. Waste removal. The dialyzer filters out waste product, excess fluid and toxin from the blood. And lastly, return of clean blood. The filtered blood is returned to the body through the second needle. This process typically lasts 3 to 5 hours and is performed multiple times a week depending on individual needs. For the fourth step, monitoring during treatment. Throughout the session, healthcare provides monitor. First, vital signs, blood pressure, heart rate and temperature. Second, blood flow rates, ensuring optimal circulation and filtration. And lastly, patient comfort, addressing any discomfort or side effect from sleep. For the last step, completion and post-treatment care. After dialysis, needle removal. The needle are carefully removed from the access site. Next, pressure application. Pressure is applied to the site to prevent bleeding. Next, dressing. A sterile dressing is applied to the access site. And for the last one, post-treatment monitoring. Patients are observed for any immediate reaction or complication. Patients are typically advised to rest briefly before resuming normal activities.
These are among the ways to prevent diabetic nephropathy. First is by maintaining good blood glucose control. Tight control of blood sugar levels helps reduce the risk of kidney damage. The target HbA1c level is usually below 7%, but these may vary depending on the patient. Second is by controlling blood pressure. High blood pressure increases the risk of kidney damage. The recommended blood pressure target is generally less than 140 for 90 mm mercury or even lower in patients with proteinuria. Third one is by monitoring kidney function regularly by routine testing of urine albumin and serum creatinine to estimate eGFR helps detect kidney problems early before they become severe. The fourth one is by using ACE inhibitors or ARBs. Medications such as ACE inhibitors or angiotensin receptor blockers (ARBs) are often prescribed to protect the kidneys, especially in patients with protein in the urine. The fifth one is by adopting a healthy lifestyle, by eating a kidney-friendly food which is low in salt, saturated fats, and protein if advised. Second one is by exercising regularly and stop smoking as it accelerates. In conclusion, diabetic nephropathy is a serious complication of diabetes that progressively damages the kidneys and can lead to kidney failure if left untreated. Its primary cause is prolonged high blood sugar levels that affect kidney functions over time. Effective management involves a combination of medical treatments, including blood sugar and blood pressure control, medications such as ACE inhibitors or ARBs. Preventing diabetic nephropathy requires early intervention through healthy lifestyle choices, strict control of blood glucose levels, and awareness of risk factors. With proper care and commitment, the progression of these conditions can be slow, significantly improving patients' quality of life and long-term health outcomes. These are the references used for this assignment. That's all from us. Thank you.